Good evening, ladies and gentlemen. Welcome to the second episode of the 360 TF Business Unplugged series. This initiative aims to unite industry leaders from various geographies and sectors to discuss significant topics of concern and importance. We are delighted to present a fireside chat spotlighting the significant role of MediBuddy in transforming healthcare. Join us as we bring together two remarkable individuals, Satish Kannan, co-founder and CEO of MediBuddy, and Vikram Lodha, co-founder and CEO of 360 TF, for what promises to be an engaging conversation. Vikram has over 20 years of experience in banking, including roles at Citibank and Kotak Mahindra Bank in India, and brings a wealth of expertise to our discussion. His passion for technology and its transformative potential in business makes him an ideal guide for today's conversation. Without further ado, let's welcome our guest, Mr. Satish Kannan, co-founder and CEO of MediBuddy. Satish is a pioneer in the online healthcare industry, an alumnus of IIT Madras, BTech and MTech in electrical engineering. After completing his education, he started his career with Philips Healthcare, being involved with research and development on specialized devices used by cardiologists for conducting surgeries. Driven by a singular focus on transforming the healthcare industry, he has, in a relatively short time frame, spearheaded his organization's rise to a leadership position. He is well on his way to achieving his goal of making high quality healthcare accessible to a billion people. Satish has been recognized by Forbes in their 30 under 30 list and honored as the Young Achiever of the Year at the National Awards for Marketing Excellence 2020. With these introductions complete, I would now like to invite our co-founder and chairman, CA Pankaj Mandra, who has known Satish closely for a few years now. Pankaj has been at the forefront of the trade finance world with over 2 decades of experience in this industry and has been leading 360 TF at various fronts like BAFT, ITWA, and ICC committees. Over to you, Pankaj, for a few words before we begin this fireside chat.
Thank you, Akshita. Thank you so much. We welcome all the guests today to listen to our dear friend SK Satish. It has been pleasure to interact with Satish for more than 2 years now. He's a great human being and a lot to learn from him. I've been part of with him in one of the interesting business schools and quite excited to see what Satish have built. Uh, he's an inspiration to all the youngsters, as Akshita have just shared that uh, he being 30 at the age of 27, being IITian, I think that's the inspiration we all have to the youngster today, where the future is in India or as well. So I've been seeing what Satish is adding value to healthcare industry, and if I'm not wrong, last what I remember, more than 25 lakh patients plus on a daily basis being taken care and treated through MediBuddy. So we have pleasure and we are grateful that Satish is there with all of us today, and we look forward to hear from him the future of MedTech. Thank you, Satish, to joining us, and we all welcome you.
Thank you. Absolutely.
I'm sure after all this introduction, everyone is waiting now to hear from Satish and Vikram. Over to you, Vikram.
Thank you, Akshita. Thank you, Pankaj. Warm welcome once again, Satish, for joining us for our monthly series on Business Unplugged. And we're very fortunate that we have you today talking about the future of MedTech. And having gone through the pandemic recently, the world is still, has scars of what went through, 4 years back. And it's very imperative that we all, take cognizance of where this is all heading to. But before we dive into the core subject, I would like to ask you, could you walk us through your personal journey that led you into the realm of MedTech and what motivated you to specifically launch MediBuddy?
No,
Over to
absolutely. I
you,
think
Satish.
definitely. No, thank you, Vikram. Thank you, Pankaj. Thank you for inviting me as well as MediBuddy to this program. I'm super excited to be here and super excited to also talk about uh, what's happening in healthcare and how MediBuddy is sort of taking a small piece or part in solving the large challenge of accessibility to good healthcare in India. Vikram, the background starts because, see, post IIT, a lot of interest in working in the healthcare ecosystem and wanted to work at the intersection of healthcare and technology. So I first worked at Philips Healthcare. And my first job was in the cardiology section. So spent a lot of time inside the operation theaters, spent a lot of time with doctors, hospitals, patients, OTs essentially. And there is an operation called angioplasty. So what happens is somebody gets a heart attack. They do a operation called angioplasty where they put a stent in the heart because there's a block in the heart, and that is actually solved using the stent that is being put in the heart. This stent that is done using a machine called cath lab, and that's how I started designing the cath lab. The lot of introduction to what happens in healthcare came because of that stint. So when we were spending a lot of time with doctors, hospitals, what we understood is uh, one, access to good quality doctors or good quality, let's say, healthcare facilities is very, very low or very, very less in India. And multiple things are contributing to this. So two large problems are all top healthcare facilities are focused in the big cities, like we know, right? And but India is a very large country, so access to healthcare is an important problem to solve. The second key problem being there's a huge shortage of doctors in India, and we have hardly like less than 6 lakh doctors who are, we call it specialists, right? So they're like 10 lakh doctors, roughly 6 lakh doctors would be GPs, and another 3 to 4 lakh doctors will be specialists. So huge shortage of doctors, uneven distribution of doctors across geographies. So all of these are problems that I saw when I was at Philips, and that is why I was thinking we should try and see whether we could solve this problem. And in my mind, building a hospital was the first idea. So I thought, okay, let's build a hospital. And but the challenge was how many hospitals can we build? And even if you build these hospitals, building a hospital in the big city is not going to be helpful. You have to travel, let's say, 100 kilometers from the big city and put up a hospital. But then the difficulty comes because the doctor cannot go to the small town. So it continues to be a challenging problem, which is when I understood that we have to deploy or develop a technology enabled platform where the first round of consultations can be done on video, but all problems cannot be solved on video. That means you do video first, then you can travel from the small town, reach the hospital. Then, of course, you can go back, and when needed for medicines, diagnostics can be done in the smaller city. So that is the overarching idea with which physical infrastructure led businesses may not be able to solve the gargantuan problem of access of good healthcare, and hence the digital platform, and hence MediBuddy started. So when we started, we were so I am a co-founder, my classmate from IIT. We did a lot of projects at school, at college, and so a lot of interest in technology that way. So he worked in another company in the healthcare space, in diabetes space, and so I got some experience from cardiac space, cardiology. He got experience in the diabetes space. Then we came together and sort of started out. When we were starting, we were like sort of two people. I think we have now scaled the organization significantly. And yeah, that's how we got into this business and continuing to scale since then.
This is fascinating. The journey has been more than a decade old now, and it's quite fascinating. See, I always used to wonder, and we have movies like Three Idiots and all saying that, if you're an engineer, why are you getting into banking? Here an engineer has got into medical now,
Healthcare. Correct.
healthcare. Yeah, fantastic. But
Ikram, I'm unable to hear you. Uh, Pankaj, are you able to hear?
Yeah, no, I think we just
Okay, we can wait. Yeah.
that's by time Vikram you know come back, we just
Yes.
see that From where you just mentioned about this gap and with your experience of Philip, and then you joined with your co-founder partner from uh, who
IT
also
college, yeah.
IIT, right? How then when you said this led to this, but what were the initial hiccups or before really MediBuddy took a shape and it was started with
No, see, like always, right? I think every company goes through different phases, and what we call as is the first phase is identifying what we call as product market fit, right? So you need to
Shit.
work a lot on identifying what is the right product, what is the right technology, what is the right solution for the market. So we call it product building phase. So you spend a lot of time in getting the right product. But once you get the right product, you move into what we call as monetization, or the revenue channels has to start kicking in. Then you start building for organization, because once you're a small team, so for initially we were 2 people, then it became 4 people, then it became 10 people. Today, MediBuddy as an organization is close to 2,000 people.
Wow.
So the third stage of the organization is more like organization building. And the fourth stage is called scaling, right? So we are sort of in the scaling stage. So you identify the right product, get the revenue channel, start the org structure, then you do for scale. So different challenges at different points of time, but that's broadly the four. And of course, you continue to keep doing that every time when you start a new line of business, because every new line of business also goes through the same journey, right? The businesses will continue to keep scaling like we.
Fantastic. I think Vikram is back.
Yeah, no,
Yeah, hi Vikram.
as technology would have it. That's the reason we were talking about the telemedicine and the remote healthcare
Correct.
completely. Now, just I'm moving on. While we're doing all this on online and through remotely working and
Correct.
bringing the tech into the entire medical space, beyond the procedural part. Now the connectivity is what you're bridging in.
Yeah.
How is the data privacy and security being looked at? Can you help us understand that space? And we now understand that there is a healthcare, insurance and portability accountability act that's come in. Any views on
Definitely.
that
No, so
particular piece?
yeah, definitely. So Vikram, I'll maybe give you the answer in like two parts. The first on the technology and why technology is the only answer to this question. See, I will tell, and then I'll talk a little more about the data privacy, both of them. So on the first point, see, let's think about how industries have evolved. And I will take two examples, then I'll talk about healthcare, right? And why technology is the differentiating factor. That is sort of the question that we were talking. See, the first I want to talk is, let's compare US and India, right? So when we go back and study the US market, the first industry that picked up a lot is, let's call it, the telecom industry. In the US, people laid copper wires to every house. That means everybody could get a landline phone and then they can talk to everybody when the family as well as the office work can be done. But if you think about whether you can lay copper wires in India and everybody would get a landline phone, it's not possible, right? Because the infrastructure investment for copper lines and copper wires in India is just not going to help. So India did not get such large adoption of telecom, like everybody may not have a phone number for phone, till the wireless came, right? Because when the technology came, suddenly the adoption was so significant that we became the largest telecom country, right? For that matter, and billion people are having a phone number now, and they're doing so many phone calls, and 3G, 4G, all of that has happened. So which means we do what we call as infrastructure led businesses, though has grown in other markets. When it becomes a software technology layer platform is only when it grows. Another example I'll tell you on banking, right? In the US, there's banks everywhere. But if there had to be a physical branch, a physical bank, and people had to go to that, I don't think everybody in India would have had a bank account. But when a platform like UPI or a mobile phone number based bank account could come, suddenly everybody has bank account and then they can transfer, buy, sell, all of that is very happening very easily. So exactly same, having a hospital everywhere in the country, ideally we would like to have, right? Given a chance, I also would like to have hospitals everywhere, but infrastructure does not allow us to do that. Our investment in healthcare is like less than 1.3% of the GDP. So if you take the GDP, if you compare to US, 16% of GDP is invested in healthcare. So you can see the size and scale difference. So which means we need to have a technology enabled platform though everybody would say, I want a hospital, I want to do it, but just very difficult to execute. Just like you could not lay copper wires, you could not lay bank branches. Now you have to do with technology. That's the first point of it, right? So which is why the viewpoint is what is possible and what is capable of, what technology is capable of enabling in the case of telecom, in the case of banking. Now, what can we do in the case of healthcare? So that is the first way to think about how technology is all pervasive. And that is why Android app, iOS app, all of this is useful to get, in simple terms, you can do many things on MediBuddy now. You can start with a video call with the doctor. If you want to meet the same doctor at his office, at his clinic, you can book an appointment, go there. At the same time, we operate close to 300 clinics. So you can go to a doctor on online, you can go to a doctor at his center, at his office, at his clinic, or you can go to close to 300 plus clinics that we operate, right? And from all of this, you can order a medicine at any part of the country. At the same time, you can get a blood test at your house in any part of the country, and all the way till you get admitted in a hospital. So that's the power of the platform, and that's the power of technology, as well as the new age. We'll talk more about AI and all of them in 1 minute. Now, data privacy is an important question.
I'll just interrupt you here. You talked about banking. I thought, let me pick
Yeah,
in.
you know very well. Yes.
So 360 TF does very similar. We've been solving the trade finance piece in the same manner. And I can so much relate to what you say from the MediBuddy journey that you have undertaken, right from teleconferencing with a doctor to getting admitted to the hospital. Yeah, it's from a solutioning perspective, it's this entire spectrum that's covered in there.
We call it end-to-end platform.
End-to-end.
And then at the same time, if you have a lot of customers pay directly on MediBuddy and get the right healthcare. If you have a insurance policy, then you can connect that one and the payment will be done by the insurer. At the same time, if your company is paying for you, we call it corporate accounts, where if a company is taking care of your healthcare, because in different markets at different locations, sometimes the company is paying, sometimes the insurer is paying. So we'll help you connect to the company or the corporate also in the process. So just to come, and the second part of the conversation was on data privacy. See, it's very important, right? Why is it very critical? Data privacy fundamentally is very important, but in the case of healthcare, all the more important because it is your personal health data and it is very sensitive also. And it's not just for you, it can be your family members, it can be your dad, it can mom, your sister, your wife, your kids, right? So it's important that health data is way more sensitive. Of course, health and banking data is like super sensitive, and in health is, it's more personal by that nature. So MediBuddy, of course, currently complies with all relevant data protection as well as security laws. We have a separate team to ensure that we comply in 100%. And because we work with large insurers, we work with large corporates, you also have to follow all the guidelines from an audit point of view. Now, from an India context, because you're talking about HIPAA, so actually HIPAA is more a data privacy guideline for US markets. So if the software as well as the systems are used in US for US patients, then they definitely have to comply with it. Because we are operating, or MediBuddy primarily operates in India and India only for now. The regulation in India is different. It's called DPDPA Act. It's called Data Privacy Act is there, and then there's one other act called IT Act. So both of these are the more relevant acts for India context, and we 100% comply with all of them. And it's necessary both from a compliance point of view, but more from a customer point of view. We are also serious about it because health is very important, and health data, and it should be accessible only for you, right? And it's very important for us to invest significantly to take care of the security as well as data protection in that context.
Absolutely. Thanks for enlightening us on that side. You touched upon, the GDP to the healthcare spend.
Correct.
Do you see that trend changing in countries, including India, globally? Do you see that trend changing post-COVID, or a consciousness that's gone up?
Yeah. So see, I think we would like it to increase a lot more, because like I told, it's like sub 2%, sub 2% for that matter. But what is the challenge in India, right? The challenge in India is we have so many priorities. Let's say if you think about the finance minister, they have so many priorities to do because we are a developing nation, right? Developed countries act differently. You're a developing country, so you have so many priorities. You need to take care of education, you need to take care of sanitation, you need to take care of health, You need to take care of everything for that matter. Finance, so many divisions are there. You need to rail loads. Roads are needed. You need infrastructure. You need bridges, all of them, right? Power plants, all of them. So if you ask me, would you like this number to be much higher? Absolutely true. Is it feasible? I think governments are working hard to ensure that more and more allotment or budget is allotted more towards healthcare. Now, how do I again tell you the same comparison, right? See, in the US, you get the best of every service at very high cost. So they got good telecom at high cost. They got good banking at high cost. Using technology, India figured out a way to give best telecom, 3G, 4G at extremely low cost because of economies of scale, right? Because you have like a billion people. So whatever you invest in can be built for scale. So same way in the US, you get best healthcare at high cost. In India, our constraint is you need to give best healthcare, but at low cost. So, and the only answer to that conundrum is technology. And that's exactly the way we are thinking about it. So we should be able to deliver similar quality healthcare at much lower cost, but you still want the GDP or healthcare expenditure should be much higher than what we have in the process. Yes.
Sure. This
Yes.
is interesting. To say on the challenges part, I'm sure from a accessibility perspective, from a affordability perspective, or quality of care perspective, MediBuddy has taken steps. Would you throw some light on that side? How are you addressing the core issue of affordability and accessibility?
No, absolutely. So I think some of this I alluded to earlier also.
Absolutely, yeah.
Yeah. So, but I'll build on that one, right? So, what are we trying to do now? You are in any part of the country. If you want to find the best pediatrician, best oncologist, best cardiologist, you will be able to find the right information, right? So, if you look at the journey of a patient or a customer, we want to ensure that first of all, you don't fall sick, right? That's more important, which means you need to have the right health as well as health advice. It can be diet, it can be sleep, it can be exercise, right? Or it can be just drinking water. So we help them what we call as preventive, and preventive healthcare is a very big portion. So people don't fall into health issue and then try to solve it in the process. So you need to give them the right advice. So we take care of that from the digital, and digital mediums are generally better at that one. You might have videos, you might have blogs in multiple languages. So it's not just in English, right? You have so many languages in India. So you can access doctors and talk to the doctors in more than 16 plus languages, right? It can be Tamil, it can be Telugu, it can be Kannada, it can be Hindi, right? So many other regional languages are also supported. So these are different ways to create accessibility, right? Accessibility is one is reach, but in the way I want it. Also, a lot of information about, see, because medical is one of the interesting insights on medical is every other industry, you pay money and you decide what you want, right? You want to buy a car, you can pay the money and say, I want a red color car, right? But in healthcare, you pay, but you don't know what is the stent that is given to you, right? Because you can't choose it. You pay money and somebody else chooses for you, right? The doctor chooses it for you, the surgeon chooses it for you in the process. So which means you need to provide them trust, right? So trust is very important in healthcare. So we spend a lot of effort to ensure that as part of accessibility, as part of reach, right information is provided to the customer about who is the best doctor, what is the price point, what are different kind of doctors available. If it's a pediatric oncologist, right? Pediatric oncologist means challenging, right? So there are very few surgeons in India who can do that, but MediBuddy will help you find the right doctor for the right health issue that you have. And so that's the different ways in which we ensure accessibility for them. And affordability is very important. The moment you create more information, essentially affordability or price points became opaque, right? In healthcare, fundamentally, price points are not so easily accessible, right? You don't know what's the exact price of it till you get to the hospital. What happens through MediBuddy is because it's an open platform, that means to say there is information that is clearly visible of what is the price points and what is it that you need to pay when you go to the doctor or get the pharmacy or get the diagnostics in the process. So the moment there is price visibility, that itself creates what we call as democratization, and hence affordability is also taken care because of technology as well as the information arbitrage is actually reduced significantly, right? So both of this helps us in both accessibility and affordability. And because we have scale, so whatever technology we invest in, the scale also helps in bringing the cost down. And a lot more work is being done in AI. So what happens in AI is because the doctor is a constrained resource, right? Because you can't
Yeah,
suddenly make a doctor. And if you have to
agree.
make a doctor would take like 10 years to become a doctor, right? They study their MBBS, then they study an MD. So by the time you are out of medical school, you're like 10 years in or 12 years in. So
Agree.
what we're doing now is a lot of work in AI is happening, which will make the doctor more productive. So he can help to get more work done in less time. Just like we use computers do a lot of work. It's not that AI will replace a doctor. Computers don't replace a human being so much. It will definitely, of course, there are a lot of different areas that can be replaced, but more importantly, from a productivity increasing, you increase the productivity of the doctor. That's like the real focus of AI. So when you increase the productivity of the doctor, price also comes down, or cost per consultation, as well as cost per advice also sort of comes down, because a lot of work is also done with the support of technology. So all of these are different ways to bring affordability in the ecosystem for healthcare.
Very interesting. Very interesting.
Yeah.
Lot of work, Sajid. Really. I'm sure as we speak, there are people who are now getting onto the MediBuddy platform and accessing the app as well.
No, absolutely, you
So
should.
this takes me to the next thought, which is coming out of our discussion. Where do you see
Yeah.
all this heading? What are the future trends or innovations that you see in this space? Do you see a lot, a higher play of artificial intelligence and wearable devices? Where is it all heading to? And MediBuddy, we understand the app is also very user friendly. What's the kind of usage that you see on the app side going forward?
Yeah, let's fast forward, right? Let's maybe take examples from other industries and also then think about how healthcare will sort of evolve over
Absolutely.
the next, let's say, 10 years in the process. So if you go
Yeah.
back and study any of the industry, every physical industry has been disrupted using a digital platform. So I'll give you some examples, right? Earlier, there used to be car companies where if it's the US, it's called Hertz, Avis, all of them. But when an Uber came, Uber did not own the car, but as a platform, Uber became much bigger than each of the companies, right? So similarly, booking.com, right? If you go to booking.com, you take your flight tickets or you book a hotel to, let's say you want to go to Marriott, you book it there, right? If you think about it, actually booking.com is much, much bigger than the airlines that you book for, right? The flight tickets,
Can't
or it's
agree
like
more. Yeah,
you got it, right?
absolutely.
Which
Yes.
means it has happened in e-commerce also. So there used to be physical businesses everywhere, but a Flipkart is much, much bigger than each of the individual physical retailing centers in the process, right? So which means it has happened in ticketing industry, it has happened in cab industry, it is happening in let's say food industry. Swiggy or Zomato is much, much bigger than each of the restaurants that is there in the process. If you extrapolate what will happen in healthcare, that's exactly what will happen, which is each of the individual hospitals is definitely needed. I'm not saying that's not needed. It's like you need a Marriott, right? Only then you can book on booking.com and go to the Marriott in a way. You can go to booking.com and book a flight ticket from Dubai to Bangalore, right? Same way, MediBuddy, so if you fast forward 10 years from today, you like go to 2030 or you go to 2035, what will be the largest healthcare company, let's say arguably in India? Would it be another hospital or would it be a technology platform that is horizontal? Right? You can see, right? If it has happened in the Uber industry, if it has happened in the Make My Trip industry, if it has happened in any of these industries, that's exactly what will happen in the case of healthcare also. And it has happened in banking also, right? There are a lot of banks, but people will use more Phone Pay and Google Pay. The back end of them is actually HDFC Bank, right? Or a Axis Bank or a Canara Bank for that matter. So that is how the future will evolve, because technology enabled platforms will become the source through which people will come, use the service, and might be the service is delivered by an Apollo hospital or a Lal Path Lab or a Manipal hospital, but the service initial the beginning and the end will happen through a platform like MediBuddy, and arguably MediBuddy will lead that foray into digital healthcare. Now, what are the other things that's happening recent in the new age is we have got more and more IoT devices. We call it health and health IoT devices, which is tracking multiple parameters for you. All of you might have a Apple Watch or a watch that will track your number of steps. Some of you might use, so we call it rings. So I also use a ring. It's called essentially various kinds of rings that will track your health parameters. It can track your sleep. All of these are helpful because they help in collecting a lot of health data of a person so that we can do personalized healthcare. So what happens today is you need to personalize it because every person is different, right? Your height is different, weight is different, your food habits are different, your sugar levels are different. All of them are different for person and men, women, all of them. Which means we need to see how to personalize healthcare and what works for one person. That's not if you do genomic sequencing of every person, what works for one person may not work for the other person, and that we have seen in the case of healthcare. So a lot of these devices on a platform like MediBuddy, when they integrate, they can collect a lot of information in one place, and AI then comes in helping the doctor sift through, let's say, lab report data, your let's say ring data, your number of steps data, and from all of this, it will start helping you to understand what is the right health advice for you, what is the right intervention, so that all of us want to ensure that you don't fall sick, or if you fall sick, also you get back to health better, right? And you want to have good health for yourself as your loved ones. So it's very important for us to ensure that it becomes personalized healthcare. So these are some of the things that is going to happen in the future. So more prominence of health test, different kind of blood test. Today, like I talked about, genomic sequencing, DNA sequencing is happening. So people can find health issues ahead of time. So today what happens is you can also predict, right? This kind of problems can come for you based on your health parameters as well as your food eating parameters, as well as predict them ahead of time and then potentially avoid people from falling sick. And if they fall sick, also find out the right mode of treatment much faster, right? So all of this is essentially what is going to happen in the future. So it'll culminate quickly where we call it omni-channel. Some will happen online, some will happen offline. A combination will happen because everything cannot be online, everything cannot be offline, but a combination will happen. Data layer will help significantly, the AI layer will help significantly, and a lot of these health devices will help significantly. And all of this will ensure that you get best healthcare, but the lowest cost, right? So all of this is doable because of
No,
a platform like
this
that.
is interesting, but there's a thought that runs in my mind when you
Uh-huh.
say that we'll get to know so much about ourselves, what's happening inside the body,
Correct.
right? Isn't it aren't we better off when we say that ignorance is a bliss at times? I get to know that I have a particular type of cell which is going to you know may become malignant tomorrow or 10 years down the line. I start worrying about it today.
Yeah, no, because
Just a
I
thought.
understand. See, no, it is true. See, I think it is more, you should look at it this way, right? Technology is always a boon as well as a bane. That's what they say, right? So we need to find out, it's like this, right? Because there is technology, because there is software like, let's call it Zoom, I'm able to do a video call with you, and so many more people are able to join from all parts of the world on the same program, right? Which means what technology can be used heavily. But of course, if people spend a lot of time on Instagram or on, I mean, we should use Instagram and whatever they like. But if you overdo it, might be it is not necessarily a good thing for yourself or your work that you need to do. So you need to find the right balance, right? So that's exactly what you need to do with healthcare as well as technology also. See, you can always get as much data, but more importantly, use it in the right way. And it is more relevant when large catastrophic health issue comes up, right? So that is why we should think about it as use it in the right manner, and it's not, it doesn't mean that it is good, it doesn't mean that it's bad, but use it in the right way. That's how we
No,
should think
I'm
about
with you. I'm with you. It's in,
it. Correct.
while I may say so, but given a choice, I would want to know what's happening
Correct.
within and
What's
within
happening inside? Correct.
and where is my body leading to,
Correct.
and take
Correct.
preventive action.
Action.
Now,
And yes.
yeah. Sorry, you're
So
saying
please go
something.
ahead. Please, no, please go ahead. Yeah, please go ahead.
So while all this is happening, how do you see, I see MediBuddy has, created a space for itself. It's kind of disrupted a few areas of operations for some of the physical players out there. But do you see competition coming in from the global markets or within India? How do you see the MedTech market globally? from a competition perspective?
No, absolutely. I think two, three things to sort of talk about. So today, I think by far the largest player in the market, we have helped close to 3 crore plus Indians who have accessed different kinds of health services through our platform. And of course, I would still say we are just scratching the surface. India is like 140 crore people, and no business is big unless you're sort of able to help a lot of people across the country. But we'll continue to be on that path to do that. See, how do we think about competition, right? So I think internally also when I talk to my team members, I think we worry more about customer and worry actually less so much about the competition. What we should think about is, are we able to follow the customer? Are we able to provide him the best services? And when the customer wants the next service, not just for himself but for his family member, is he coming to MediBuddy and trying to find the next service for himself, his parents, for anybody, for that different kind of services, right? Doctor, labs, medicines. So first view is think customer backward, may not be so much competitor backward, because you will then be on the right path. And the reason why we have been able to grow significantly is also because we just obsess about the customer, right? We just worry a lot about what works for the customer. If the customer experience, we call it experience, customer satisfaction or customer experience, that is the real focus to think about. Now, having said that, what are some of the differentiations that MediBuddy has when compared to the competition and others? Because it's important to think about from a strategic point of view. The key points are: one, MediBuddy has done a lot of partnerships as well as integration with a lot of hospitals, doctors, pharmacies. So we call it providers or partners who are providing the service. So because we have done so many integrations into all the equivalent of ERP systems, right? So that means we are already there in their systems. So very difficult to be displaced from a provider point of view, doctors, labs, pharmacies, and so on. On this side, we have integrated, on the customer side, we have integrated into large corporates, large insurers, which means it's very difficult for somebody to suddenly change the integration and then start a new integration. You got it, right? Which means you have brought together significant retention mechanisms, right? Customer is connected on the customer hearing corporate and insurer is connected, the hospital is connected. So very difficult for somebody else to suddenly come in and displace this. So we call it moats, right? You've created moats in the system, which will ensure that business continues to be strong. And of course, customer experience is important, right? At any point of time, just because integration exists doesn't mean customer will stay. We'll get a little longer duration. So build what we call as moats. You have multiple moats being built: customer moat, you have built provider moat, you have built customer experience, then you build brand on the top of it. Because even if there are two hospitals, which hospital will you go to is more based not so much on price, but more
Brand.
about trust, brand
Yeah.
and trust, right? Because you know that health is very important, so you want to go to a trusted place. So MediBuddy has also built a brand over many years now, and we continue to invest in brand, because if there are two choices and both of them are equally same on price, the only differentiation is going to be trust. I trust this one more, so I'll go here. So we have built all of these different customer side, provider side, technology, customer experience, brand. And when you layer one after one after one after one, you continue to become very strong, which is also why you'll continue to have significant market leadership going forward. So that's how we think about uh, markets and growth, and
No,
worry
very
more customer,
interesting.
less about competition.
Very interesting. Very interesting. Any plans to go overseas?
Yeah, so I think for
Or
now, no, yeah.
Come to
So
the
for now,
point.
for now, yeah, no. I think we will think about that in some time. For now, the
yeah,
focus is going to be sort of India. But what I know for sure is very similar problem statements exist in a lot of Southeast Asia markets, because
Akash,
when, yeah,
we
Middle East,
sorry, I'm kind of coming in.
please.
Multiple markets, Satish.
Yeah,
We cover multiple geographies in our format of business. We are
nice,
in cross-border trade, and we happen to look at or have visibility of multiple countries.
correct,
Look at geographies like entire Africa and
correct.
50 plus country continent. You'll find this problem almost every country you visit. So it's a
Yeah,
large appetite, large potential for you. That's the reason I
no,
kind of came in. You want to go overseas as well.
No, definitely. And it's a very right question also, because see, healthcare is universal, right? Everybody wants good healthcare. Everybody wants high quality healthcare at low cost, which is also taken care in the process. And a platform like MediBuddy can be deployed in any market, because on one side you connect the partners, one side you connect the customers, and the same platform is it's actually location agnostics. It is also language agnostic, right? Which means you can actually deploy any new language, because there's so many languages already running on MediBuddy, which means any new language in a new country is just another language for us to deploy.
Yeah.
So and
Anyways,
problems are similar.
lot of people come to India for healthcare, right? So you have
So I
a
think
global.
there are multiple ways to think. Either we deploy MediBuddy in other markets, or you open it up so that we call it medical tourism. India is very good at providing good healthcare to a lot of people. So which means people can travel from other markets and come to India. So all of these are opportunities, but I think for now, for the next 18 months, we'll focus only on India, and then we'll evaluate how
So
we think about other markets.
just kind of completing this piece,
Yes.
what is it that, support from a role perspective, what support does government bring to you?
Yeah, absolutely. So I
Healthcare tourism or a policy framework.
So, I think when you think about it, right? So, government has taken very, very good as well as very progressive steps across industries, and especially in healthcare. So, let's say before 2019 or before 2020, before COVID, if you think about it, doing an online consultation was okay. People were still doing it, but there were a lot of legalities around it, which was not very, very clear. But the moment COVID happened, as well as the challenges that came along with it, India was actually very, very progressive. The government was extremely progressive, which came out with the right guidelines immediately, right? On what is to be done, how we can do online, because online pharmacy also had some set of regulatory activities that is work was that is happening, but that has also become more and more clearer now. So a country like India needs to ensure that innovation prospers, right? You need to get more and more people to think innovatively. Only then we can come up with the innovative solution to solve the problem of the country. And regulation as well as all of the laws should focus on growing the innovation and not stifle it, right? So that way, I think government has been very, very supportive. Yeah.
I'm with you absolutely. That should be the focus. So kind of concluding our set of questions, or my set of questions.
Please.
I would end this with one thing from my side, or maybe two put together. The one, if you can share a notable story, in your 10 years plus journey in MediBuddy, what's one story that you remember all the time and has been really with you? That's question number one from my side. And two, the techie in you, okay, the techie in Satish, what does it do when when you're sitting in a meeting? You open up a diary and take a physical note, or you use some form of technology to record it?
I'll answer the second one first, and then the first one later. No, see, I think how should we think about this, right? See, technology enables in accelerating progress, right? And if that helps you in saving time, or if it helps you in being more productive, it helps you in reaching more audience, or helping you collecting more information in less time, I think we should use it, right? I think there used to be a statement that since people earlier used to walk, then somebody found a bicycle, right? So now, the moment you get on a bicycle, you're reaching the same destination, might be faster. Bicycle led to a car led to a airplane. That is all different. But if you think the first one might be four wheels and one vehicle that started from there, right? Which means exactly same is what technology is to your mind, right? So all of this technology helps you doing that. So I use all of the tools that are available. I do a lot of notes on digital, because I can always share it later and collect later. You can do video recording. AI tools are there now, where if you're doing this conversation, it'll actually listen to all of them. It'll actually write it down for you. It'll summarize it for you. So all of these are different tools. I'm not saying one is good, one is bad, but more importantly, do what works for you. But I like technology, so I spend a lot of time tinkering around with everything that new is available in the market for getting. The other one, I think at different points of time, there has been different kind of learnings that I've had. and I'm pretty happy about it. So I think overarchingly, what I'm very happy about is I see a lot of people really in very small towns never got any healthcare access, and I'm very happy about this because I used to travel to all of these big cities, then travel again 100 kilometers outside from there and go meet customers in all these small towns, right? So and every time I have done it, I've seen very warm response because people used to say we could never talk to a cardiologist, we could never talk to a gynecologist, right? We could never talk to a pediatrician, and where we could never talk to anybody in onco cancer, right? But they got the right advice at the right time, and that saved a lot of lives for people. And so that I think is I'm very happy that at least the platform is helping a lot of people, and overarchingly that's the only thing that I'm very happy about when I think about the work that we're doing.
Satish, it's been wonderful, and the work that you are doing and MediBuddy, everyone at MediBuddy is doing is exceptional. Our
Thank you.
best wishes to you. You keep growing and keep serving a lot of customers. And I love the way you're talking. You're calling them customers and not a patient, because at the end of the day, that customer is a patient. Yeah, fantastic
Yeah,
work,
thank you.
Satish. It was a pleasure having you today. And I hand it over to Akshita. Yeah.
Yeah, I'll only say one more thing. It's all day one, right? We're all getting started. I think there's a lot of time ahead of us and a lot of work to do. But I think it's just day one from a start point of view. Absolutely, yeah.
And absolutely. I hand it over to Pankaj. Pankaj, over to you. Thank you.
Please.
So, Satish, I have an interesting message received by one of our audience one-on-one. A
Please.
lot of time, a patient or a son or a sibling or a daughter of a patient who looking for a specific treatment. So I got a message that there's Dr. Shiv Sareen, who's a specialist of liver
Yes.
in India and most sought after doctor. And now this say audience over here, he's looking to get appointment, which he's getting appointment after 6 and 9 months. How does MediBuddy help? I see from two perspectives. One, there's a requirement whereas someone is looking for a specific doctor, he's the best doctor in the country, which and the challenge is not the cost, but challenge is to getting the appointment at the right time.
Correct.
This is one
Correct.
perspective. I will share that how do MediBuddy help in that, when especially come to them that I want this doctor. Secondly, from a business perspective, I'm coming from a commercial mindset. Do you have this premium service that you will get appointment to this doctor, but there is a premium service to it. So look forward to hear your.
No, I answer both of them, right? So, but fundamentally, what you said is exactly right. So, see, the reason why MediBuddy is able to do that is because we have deep relationships running with all large hospitals, right? All hospitals, doctors, pharmacies, diagnostic centers, because a lot of customers come to these hospitals, first come to MediBuddy, check, some is covered by insurance, some is covered by the company, some is paid out of pocket, right? Which means a lot of throughput. So many customers come and go to these hospitals. So we have what we call as blocked slots, right? So that's because so many customers come through us. So we have pre-blocked, pre-booked slots on MediBuddy, and very loosely think like this, right? In a cinema hall, Book My Show always has certain set of slots booked for them, and forward, right? Because they have it done, and some slots will be open for the walk-in customers or equivalent of that. Very loosely take that and put it in healthcare, and we should. So that is why we are able to identify as well as get appointment slots or equivalent of the slots from the large hospitals, because we are a large source of customers for everybody. So hence we have the ability to sort of do that. The second question is on premium customer. See, generally how I think about healthcare is the aim is to use technology to democratize this. Okay. If you are a super VIP customer, you will get it in India, right? But I'm trying to figure out whether you don't have to be a VIP customer, right? But you still should be able to access the right doctor and right healthcare. And of course, the problem should be complicated enough. Otherwise, the doctor's time is also very valuable. So we don't have a premium customer model. I think fundamentally we have but of course, there are subscription programs. You can always take what we call as a MediBuddy Gold, or it's like a subscription program which gives you some certain benefits, but it's not very costly, right? It is some 2,500 rupees. But that means you still get all of the services you'll get, but you'll get, of course, for the full family for the full year. So people can, of course, take we call it MediBuddy Gold. So that is also available for people that will get some certain set of extra benefits. You'll get some discounts on the top of it. But that's how we should think about
I think
getting to the right answer. Right? Yes.
my takeaway is that I'm sure as a large aggregator and a
Correct.
health service provider in India, whether I need a right doctor at Apollo Hospital or
Correct.
Jamnabai, any Ambani hospital, any best hospital where of course doctor will be in the queue
Right.
because as you said that you have these premium slots being booked. I think it's
Correct.
more reason for people to be there because you don't know when you will require this. Now this is very
Correct.
very
Correct.
interesting. I think we have two three good questions in the chat box which
Please.
we saw. One
Yes.
minute.
Yeah. Please feel free to ask any question. I can answer. I think there are a bunch of questions in the Q&A.
Rohit Chitlangya, is the industry mature to see M&A come in play for faster and large coverage? Also, how do you manage conflict when the hospital itself has e-consultation platform similar to
Similar to
MediBuddy?
MediBuddy. No, definitely. So I'll talk more about M&A. So, like right, MediBuddy has done multiple mergers and acquisitions over the last few years. The recent one that we had acquired was a company called V Health. So there's a US insurance company called Aetna, and they had an India office called V Health. So MediBuddy had acquired in February 23, exactly roughly 1 year ago. We had acquired the full operations of this division, and we bought out the team and the full division from the US entity, and the US entity then exited India. So what the reason why we have done that is, like right, healthcare is very large, and we continue to see what are the new areas to go into. The new areas that is now emerging a lot is mental health, like right. Though of course a lot of us are popping pills, but when it comes to mental health, it's very important to first create awareness, and then of course find the right advice for a psychologist, psychiatrist, and it's very important for us to sort of understand that it is still seen as a taboo, but mental health is one important area to think about. There is a lot of work to be done in the area of weight management, diabetes, and all of them. So, like always in every industry, after the industry goes to a scale, there's a lot of consolidation phase, a phase of consolidation that happens. And it has happened if you go back and think, right? Once upon a time, there's so many e-commerce companies, but over time, it finally became 2 or 3. There's only Flipkart now, maybe Amazon now. There are so many cab companies. Finally, it was Ola and Uber in a way in the process, right? So that's exactly what will happen. So industry is mature. It's starting to see M&As. We have done a bunch of acquisition. Before we helped, we did an acquisition called Clinics. Before that, we had done another acquisition. Before that, we had done DocWise. So multiple things that we have done to ensure that. Why do we do this, right? Because we need to provide all services to the customer on a same platform, and they should not leave this platform. That means you're creating challenge for the customer. And sometimes you do buy means you do M&A. Sometimes you do build means you build it from scratch, right? So both of this is the right way to think about it. The question on conflict, so think like this. Samsung has a mobile phone, Samsung has a website. Do you buy your phone from Samsung's website, or do you go to Flipkart and buy the Samsung phone, right? So it is because generally customer likes to have one platform where, because he goes to, let's say, Flipkart, he can buy a Samsung phone, he can buy an iPhone, he can buy a OnePlus or any of them. At the same time, he can also go to Samsung's website and do. So from a customer point of view, when you think backward, he wants one place where he can go to find a doctor, then lab, then pharmacy. So every hospital will have their own software. You can go there also, but you will also be having a platform like MediBuddy where you can go. So I always compare Flipkart website and Samsung website. Similarly, you can compare MediBuddy website and any hospital's own website. Like we know, customer will choose a platform like MediBuddy. So there's no conflict. You can go here also, go there also. But on
Correct.
MediBuddy, why it's powerful is because records are there. No, all the records are kept in the same place. Yes.
So interestingly, we have our head of global corporate says Lokesh. He said the same thing. You can deal with one bank, but you want to get the best transaction where you want to come with Standard Chartered, Citi, BNP Paribas, and everyone. And that is the reason 360 TFF. I think
Correct.
uh,
Absolutely.
this give more reasons to the aggregator because you get a choice, you get a better pricing and a
Correct.
better option. And of course, you said the data dashboards and the analytics. No,
Correct.
seriously.
Correct.
So we have something interesting from Mahavir Ved. can this app store, the medical store, record secured and referred as and when required? Also, when will MediBuddy assign Mediclaim option easier when one opts to claim before even getting admitted, or even one can claim later after completion of all the treatments?
No, no, absolutely. I think definitely. I think. Mohammed, thank you for the question, but definitely we can do this one. So, see, okay. Another point we didn't talk about earlier was all records on MediBuddy can also be tagged to what we call as Aadhaar. So, like Aadhaar, everybody has an Aadhaar. Government of India has also come up with another regulation we couldn't talk about earlier. It's called Ayushman Bharat Health, right? Which means you are able to connect all your medical records to your Aadhaar ID. So ABBA ID is essentially based on your Aadhaar, you'll get a medical ID, and all your medical records can be connected to that. So wherever you go, you have access to all your records in one place. So MediBuddy is one of the earliest platforms which adopted ABBA. So all medical records on MediBuddy can be connected to ABBA, and you can access it anywhere. And it's also right. If you go to a hospital, you can request the hospital to upload the record into your ABBA ID, and hospitals have to do it. Of course, maybe some of the hospitals have not still integrated, they have not built the system, but government has given a directive that all the hospitals, pharmacies, diagnostic centers should definitely provide the right medical records back into the system, and that's doable. And of course, the question is on claims. Yeah, MediBuddy at the back end also integrates to the insurer, and there is a third party administrator. So sometimes all of these claims goes to, we call it TPA, or a third party administrator, and we will help you in both. I think he has asked questions on claim before and claim later. So we call it pre-authorization. That means before you go, you can do that on the platform. And second one is called as reimbursement, right? That means you pay the money, then you reimburse the bill. So MediBuddy helps you. So ideally, what MediBuddy wants to do is you don't have to do reimbursement at all, right? If you come to MediBuddy, if you're choosing a hospital, you can choose the hospital, trigger your insurer, and say, I want to get admitted tomorrow or day after tomorrow. And you can do that way. If you do it that way, it's called cashless service. You don't pay the money. Of course, if you have already paid because of emergency, you didn't have a way to, let's say, come back and find all the details on MediBuddy, you can always do reimbursement. So you can do reimbursement also. So MediBuddy, that's why it's powerful, because I think we process significant amount of claims across the country through MediBuddy, and every large hospital is also there. And if you come through MediBuddy, it is better because it'll be cashless for you, and it'll also be cheaper for you. Because when you do reimbursement, you have to pay money, and generally it turns out to be slightly more costlier. If you pay first, then you try to get the reimbursement from there. So that's also very doable on MediBuddy.
Fantastic. We talked about the whole MedTech today, and I think a lot of takeaways from the industry, as well as we see there's an opportunity. But just going back to, as a founder, as you're building this business, and as you said, there's a lot of opportunity, because what you talked about, the GDP spend, 1.5 versus US, what has been spent, is a huge opportunity. But from a MediBuddy perspective, and as a co-founder perspective, where you see MediBuddy going public, what do you see years time, 2 years time, where you see that you going to open and go to public for an IPO?
Absolutely, Pankaj. I think very good question. See, how do we think about it, right? So we believe once company reaches a size and scale of operations, as well as also gets to, because you do a lot of investment initially. So for last many years, you're continuing to invest in the business. We'll continue to do, but the core business is now turning profitable. So that way, I think there is strength in the core business, and economics is looking pretty strong in the process. And we'll continue to keep scaling. So I think now we are in a good shape. From a public market point of view, see, like we know, we have broadly 2 to 3 years as a horizon that we think about it. So we will evaluate. Of course, there are multiple opportunities, like right? There can be you do more private equity, or you do strategic, you do work on public markets. So we think we will evaluate in 2 to 3 years time, and think about how we go public. But the idea is continue to help customers, right? In different shapes and formats. You can be a private company, you can be a public company, but make sure that patients are happy or customers are happy, right? So that's how we think about it. Might be in 2 to 3 years span we'll think about.
Perfect. Now, this is great. Thank you. We have some interesting polls to see that how serious for the audience today. Saksham, Akshita, are we ready?
Yes. So, audience would request you to please give your answers for a quick poll we have.
Awesome. Let's go live. We are keeping this data, Satish, for giving our audience today a pre-IPO opportunity also after 3 years.
We'll give special window. We'll give special window for them. Huh? Okay.
Yes. Okay. Audience able to
Yeah,
vote?
I hope people are able to vote. Yeah, yeah, I can see the answers coming in.
Voting, Nanda voting, Nayak voting, Lokesh voting. Interesting. So this is Satish. We started to know your speaker.
Okay, nice,
Your
nice.
KYC.
Oh, KYC, yeah. Know your customer, know your speaker now.
How many of them have heard, interestingly? I just
No,
saw
very good, I think. Good.
Satish voted. Interesting. Second question: when it was listed by Forbes 30/30? 24 years, 25
Actually, I did
years
not remember that point. Okay, so
So that's the inspiration.
I do
In
not
fact,
remember that. Yeah. No, I think we should just focus on the work that we do, right? So that okay.
fantastic. Satish, you have to evaluate whether the answers are correct or not.
No. I think I'm happy with everything. Right? Whatever people say is fine.
That's fine.
We are good. Yeah.
Thank you. It's Satish, indeed a pleasure to have you here. We see a lot of queries and some requests to connect with MediBuddy, which will of course connect to your team, to Apurva and your team, to see how our members and audience can also get benefited by using MediBuddy, or require some connectivity as relevant doctors in
Yeah,
your
please.
hospital. Yeah.
No, definitely. I'll be very happy to support. Right? Anything that's related to healthcare, we'll definitely be happy to support. As a platform, that's our aim, right? To ensure that you get the right information, and we'll be sort of happy to do. And hopefully, I think people found some value and could learn a bit about healthcare might be in today's conversation. So thank you, Pankaj, thank you, Vikram, thank you everybody for inviting me as well as MediBuddy to the program.
Thanks to the whole MediBuddy team, and thank you, Satish. And see you tomorrow morning.
Yeah, we have separate catches. Correct. Yeah.
Thank you, Satish. Thanks for your time, and thanks to the entire MediBuddy team for putting it all together, along with the 360 TF team. And I'm sure we've got enriched today on multiple fronts with respect to the entire MedTech space, and we continue to collaborate and see how best we can do more and more, and wish you all the best in whatever you're doing. You are serving the society in more than one ways. All the best.
Absolutely. Thank you, Vikram. Thank you,
Thank you.
Pankaj. Thank you. Doing
1
great
minute,
work.
guys. Sorry, one group picture. We can have camera on.
Yeah, please.
Yeah.
We should do group picture. Yeah, let's do that.
I'll just take the picture.
Yeah.
Smile. Yes.
Thank you.
Perfect.
Thank you.
Thank you, everyone who joined us for this fireside chat. Stay tuned as we unfold the next episode for our Business Unplugged series. Thank you. Thank you, everyone.
Thank you all. See you.